Lung cancer is the #1 cancer-related killer in the United States and worldwide. And robotic bronchoscopy is a new technology that really is an absolute game changer when it comes to the detection and diagnosis of lung cancer. In the past, the different forms of biopsy tools that we had were either doing a CT scan and putting a needle from the outside going through the surface of the chest through the lung, and there was always some risk of causing injury to the lung when we do this and collapse in the lung because we're literally puncturing it with a needle when we do that, versus sending patients directly to surgery to have these abnormal spots removed by a surgeon, and if it turned out that it wasn't a cancer, then that may have been considered an unnecessary surgery. With our new technology, what we're able to do in a much safer manner, when it comes to sampling small areas of abnormal tissue in the lung, going from the natural airways of the lung without having to puncture the lung surface itself, these airways get smaller and smaller. Sometimes they're as big around as a couple of hairs almost, getting to locations that are much more difficult to access and spots that are as small as a pea, for example. So the way one of these procedures works is that we schedule a procedure in the operating room where the patient comes in, we obtain a new CT scan at a high resolution that allows us to create the three-dimensional model and navigational path that we need for our robotic bronchoscopy platform. And once the patient is under anesthesia, through the breathing tube that's inserted by the anesthesiologist, we connect our robotic bronchoscopy catheter, and using a motorized arm that directs this catheter back and forth, we direct it very much like you would imagine driving a drone, for example. So you go back and forth, you go left and right, up and down. Once we start sampling the area, we generally will have our pathology colleagues who are doctors who specialize in looking at tissue and telling us what they find. And if on our initial approach we're not getting the kind of samples we want, that allows us to make adjustments and make sure that we effectively get the tissue that we're looking for. Typically by the time lung cancers become symptomatic, so the patient actually comes in complaining of chest pain or shortness of breath or cough and things like that, it's already too widespread and there's not a whole lot we can do about it. So the name of the game in helping patients with lung cancer survive has always been early detection and early treatment. And at Methodist Hospital, we have a comprehensive lung cancer program that takes a patient through the entire experience, from determining their risk factors and whether or not they need to be enrolled in a lung cancer screening program, and then being able to deal with any findings that we have all the way through surveillance to biopsies for detection and then treatment planning.